But for the people who are vaccinated, the people who can get boosted, enjoy your holiday season with your family, indoors, grandparents, children, do it. But be aware that when you are in a situation where you are traveling, for example, and you are in an indoor congregate setting and you don't know the vaccination status of people, you need to wear a mask. But in the family setting, particularly among vaccinated people, enjoy the holiday.
For the second time since the pandemic began, Americans will celebrate Thanksgiving. But thanks to vaccines, 2/3 of Americans are planning on gathering with friends and families tomorrow, just as they did before the pandemic, according to a new polling. In the background, however, coronavirus cases are on the rise. The country has seen an average of 95,000 new cases a day, a 25% increase over the last 2 weeks, according to the New York Times. Conditions are the worst in parts of the Northeast and Midwest. In Michigan especially, hospitalizations of COVID patients, most of whom are unvaccinated, are approaching numbers unseen since the most dire days of the pandemic last year. Joining us now to discuss how Americans can keep themselves and their families safe during the holidays, Dr. Corey Hébert, BNC Chief Medical Correspondent, and Dr. Oni Blackstock, Founder and Executive Director of Health Justice. Dr. Hébert, please tell me I'm not going to have to try to sneak my turkey up under my mask at the Thanksgiving table.
Wash up, mask up, separate, and vaccinate. I've said it throughout this entire pandemic, and it's now ringing true more than ever. 95,000 cases. We've opened up our borders just because we've got some economic pressure to get people from out of the country to come into this country and help with our gross national product, which is going to be a really big problem, Charles, because we know that the numbers are surging throughout the world. People are going to be crisscrossing the United States for the next 3 to 4 weeks, and I think it's a really big problem. We know this is now a pandemic of the unvaccinated. We as Black people continue to push the concept of the Tuskegee experiment, and that's why we're not going to get vaccinated. And meanwhile, we're just scared and nervous, and now we have to kind of abandon that feeling of being scared and nervous, because over 1 billion people have gotten this vaccine, and you're going to be sitting across from someone who is pregnant, possibly, that may not know, that has a 4 times higher risk of having a stillborn if they got the Delta variant, or somebody that, like Colin Powell, that has a disease that causes them to have a depressed immune system, and you're going to sit right there and give them COVID-19, and all the Black folks are going to have a problem, all the white folks are going to be fine, and here we are. Now, you can eat as much turkey as you want. Just make sure you don't eat any pumpkin pie. Just make sure you eat sweet potato with all that bad news, I'm sorry to say.
You know, Dr. Blackstock, I mean, Hébert's going to have me out on the porch with my turkey, and I'm not going to be with my family. Listen, seriously, I don't want to know, like, how should we start to think about this? We keep cycling through, right? So we think we're kind of going in the right direction. The numbers look good, and all of a sudden we come surging back with more cases. I mean, how do we think about that? Do we ever really get to a point with this thing that we're going to be done with it? Or is it just going to be kind of endemic in the population that eventually everyone will either be vaccinated, have had it and recovered, or have had it and died?
Mm-hmm. Yeah, no, it feels like Groundhog's Day. We were sort of in a similar position this time last year. And, you know, this is the result of a confluence of factors. You know, we have a number of states that have relaxed mask mandates. We've relaxed a lot of the other sort of capacity restrictions. And so this is in part related to that. We also have cooler weather that's pushing people indoors. A number of people, millions of people have been vaccinated, but many people have been vaccinated over 6 months ago. And we know that with the vaccinations over time, there is waning or decreasing protection against infection across all groups. And then lastly, we're still dealing with the Delta variant, which is a highly transmissible variant. And so putting all those factors together has led us to this surge. But the reality is that we are not doing anything differently. We're continuing with the status quo, and we really need federal and state leadership to really step forward and use the full toolkit of mitigation measures. We need to see mask mandates. We may need to see capacity restrictions. We need to make rapid testing also highly available. So there's a lot that we can do that's not happening, and that's why we're continuing to have these recurrent surges. And it's possible that we're going to be with this virus for some time until we learn our lesson, and hopefully that happens soon. So we'll see what happens, but we are in the early stages of what looks like another significant surge.
So, Hébert, what do we do about vaccination? Vaccines help tremendously. They work, right? But we saw kind of an artificial increase in vaccines. They went up because people got freaked out that their kids weren't going to go back to school, be able to go back to school. They went up because federal government says you can't come back here unless you get vaccinated. Went up because athletes were being told you cannot play or practice if you do not get vaccinated. It wasn't because people were spurred out of civic and social responsibility. It was that they were being forced. Are we just going to hit a limit beyond which we cannot force, that all of the spaces in which we could force people to get vaccinated, we've done it?
Well, when you hit people in the wallet, or you hit them with embarrassment, or you hit them with some type of punitive measure, then generally people will try to do something that they wouldn't normally do. And that's the only motivating factor, is fear and money, right? But what we've got to really remember now is that we have to do it for our culture. I mean, if you don't do it the right way now, Medea that's going to be sitting at that table ain't going to be there next Thanksgiving and Christmas, because she's going to die from COVID-19, because that was the way it was last Christmas when I sat here with you and explained to people that if you do what you're supposed to do this Christmas and Thanksgiving, you'll have a normal one next one. And here we are again in the same situation. What we have to remember now is that as we move forward, we have got to make sure that we remember the mantra of wash up, mask up, separate, and vaccinate. And if we do that appropriately and break through some of these barriers of ignorance that we have, and it's not something that when I say ignorance, I'm not trying to shade anybody. What I'm saying is the fact that we don't know about science, and we think that we do. I mean, literally, my postman came to me and told me he wasn't going to get the vaccine because of his research. I just got published in the New England Journal of Medicine for my research on monoclonal antibodies, but he's telling me what he's not going to do. But the reality is, I'm like, dude, you can't even read 4 numbers on my street sign on my house to put in the right mail in my mailbox for the past 15 years. So why do you feel like you have the ego to tell me about COVID-19 and the concept of vaccinology? So we have to get, and like people like Dr. Blackstock and her sister, who they are doing, I mean, great things throughout the United States. We have got to get, as Black doctors that speak this language, we got to get in the streets, Charles. We have to get in the streets, because if not, our blood is going to be on the streets, not theirs, ours. Because we are the ones that are not vaccinated, and they're opening up everything in the world. But we're the ones that are not vaccinated, and we're the ones that are going to die.
Dr. Blackstock, thank you so much for joining us. Dr. Hébert, the next time you're on this show, you turn off that golf tournament. We're watching the reflection of the golf tournament in your window. I'm trying to figure out who's up and who's over
you
and
need
who's
to focus
under.
On me.
Turn
focus
that
on
off.
Me. You focus.
When you turn your TV off, we can focus on you. Turn your TV off, we can focus on you, sir. Thank you so much, guys, for joining us. I appreciate it.